In this video, I'll be talking about the extraintestinal manifestation of the inflammatory bowel disorder. And in later half, I shall be talking about important features related to the disorders. So to begin with, rheumatological manifestation, they are of two types. One, depends on the bowel activity, which means if you treat the patient's bowel, these manifestations will automatically subside. And in this domain, we have got only peripheral arthritis, which correlates with the bowel activity. The second is sacroiliitis and ankylosing spondylitis, which have no relation with bowel activity. Second group of disorders are dermatological disorders, in which case pyoderma gangrenosum and psoriasis are unrelated to bowel activity, whereas erythema nodosum, pyoderma vegetans, metastatic Crohn's disorder, Sweet syndrome and Aphthous ulcer, they relate to the bowel activity. Ocular manifestations, for example episcleritis, they depend on the bowel activity, and uveitis, it does not depend upon the bowel activity. In hepatobiliary domain, the primary sclerosing cholangitis is present in maximum patients of ulcerative colitis, and around 10% of TSC patients will progress to cholangiocarcinoma. The other manifestations could be fatty liver or choledocholithiasis. Now let's talk about certain important features of UC and Crohn's disease. There are two important lab markers. One is the fecal lactoferrin. Fecal lactoferrin is actually specific for intestinal inflammation. Fecal calprotectin is associated with three things. First of all, it correlates with the histology, it predicts relapse, and third, it detects pouchitis in ulcerative colitis patient. Ulcerative colitis patients can present with toxic megacolon when the colon becomes more than 6 cm in diameter. In this case, you get a very characteristic feature that is called as hepatic tympany. Ulcerative colitis patients can also present with constipation apart from manifesting with diarrhea. Constipation usually happens because of pouchitis and proctosigmoiditis. If you want to know more about the disorders, kindly subscribe to my channel.